Hi, I'm Michael. I'm a freshman at Union College in the 8-year accelerated triple degree program in medicine. I've been working on this project. I just finished it up about 3 months ago. I started working on it in 11th grade, so 2 years ago now. And my topic is on the effects of video gaming on Tourette syndrome. So what is Tourette syndrome, which I'll refer to as TS throughout the session? Basically, Tourette's is a neurological disorder that's primarily characterized by tics. Tics are, as you can see here, rapid, repetitive, unwanted sounds and movements. Um, the exact causes of tics are unknown, but it's theorized that they are due to genetic mutations on chromosome 2 and chromosome X, which lead to an excess in dopamine levels, specifically the flavor of D2. Flavor is a type of dopamine. Um, the ratio of typically males have are 3 times more likely to have Tourette syndrome than females. And basically, or physiologically, Tourette's leads to reduced activity of the tonically active neurons, as well as the fast spiking neurons, which ultimately reduce the activity of the medium spiny neurons, which ultimately reduces regulation of GABA, which is the primary inhibitory neurotransmitter. That's not important for this session. That's just the basis of how it works in the brain. Comorbidities. A comorbidity is a disorder or condition that is simultaneously present with another disorder or condition. The main comorbidities of Tourette's is OCD and ADHD. The primary topic of this presentation will be on ADHD. Overall, ADHD is due to elevated levels of DAT in the striatum, which ultimately reduce dopamine levels. There's an inverse relationship between DAT and dopamine, which will be explained more later on. And ADHD primarily affects systems in the frontal lobe. So what are current treatments of Tourette's? Overall, the primary treatment are pharmaceutical drugs, namely guanfacine, for example. But these medications do have side effects as well, and potentially undesirable side effects that may draw people away from these medications. Other options are Botox injections and DBS, or deep brain stimulation, but these are more invasive measures and are not always feasible. Comprehensive behavioral intervention for tics is a new avenue that's based on a psychological approach to reducing the premonitory urge to tic. It basically focuses on focusing the mind on something else to get it away from wanting to tic. And based on my project is, can video gaming be an effective form of this treatment, CBIT? I'm not going to explain, the different types of video gaming, but what's important is that video gaming increases serotonin levels. This has a wide range of effects for OCD, but then again, not that important for this project. What's more important is that video gaming reduces raclopride. Now, raclopride is a dopamine antagonist. In essence, there's an inverse relationship between raclopride and dopamine, specifically the flavor of D2. So with the reduction, and let me backtrack, the greatest reduction was found in the striatum. And as stated before, ADHD presence is based on DAT levels in the striatum around the frontal lobe. So that's what's important here. So a reduction in raclopride would increase dopamine levels. Before I get into this, it should be known that reducing the symptoms of comorbidities of Tourette's, such as ADHD, can reduce the symptoms of TS. So, for example, reducing the symptoms of ADHD will reduce the level of tics, theoretically. Now, for ADHD, there's an inverse relationship between D2 supply and GABA supply. GABA, as we stated before, is the primary inhibitory neuron. So because video gaming increases serotonin, this ultimately releases enkephalines, which are a class of endorphins, and this reduces GABA. As previously stated, there's an inverse relationship between GABA and D2. So a reduction in GABA increases D2 levels. Now, patients with TS and comorbid ADHD likely have reduced D2 in the frontal lobe. I'm assuming this because there's increased levels of DAT for patients with comorbid ADHD in the frontal lobe, because ADHD is a dysfunction of systems in the frontal lobe and around the striatum due to elevated levels of DAT. Now, this will tie it all together. Methylphenidate is an ADHD medication. Methylphenidate leads to a decrease in D2 levels in the basal ganglia. But ADHD is focused on the frontal lobe and the striatum. So because ADHD is a result of decreased D2 levels in the frontal lobe, it can be suggested that there is a relationship between the D2 levels in the basal ganglia and the frontal lobe. In essence, ADHD medication fundamentally serves, the purpose of it is to increase D2 levels. Now, that may seem contradictory to our goal with Tourette's, because there's an increase, because Tourette's is a result of increased D2 levels in the basal ganglia. Now, because methylphenidate decreases D2 levels in the basal ganglia, it may be suggested that by decreasing the D2 levels in the basal ganglia, it increases the D2 levels in the frontal lobe, which would reduce the effects of both ADHD and Tourette's. So there may be a passage of communication with respect to D2 between the frontal lobe and the basal ganglia that could lead to like an effective video game as an effective form of CBIT. So that's the main important part here. So to tie it all together, raclopride, that should be decrease. There's a decrease in raclopride when video gaming. This combats the elevated DAT levels in the striatum. Because there's an inverse relationship between DAT and D2, the reduction in DAT leads to an increase in D2 in the frontal lobe. And as shown by the medication methylphenidate, if the D2 communication pathway between the frontal lobe and the basal ganglia is present, the increase in D2 in the frontal lobe could simultaneously coexist with a decrease in D2 levels in the basal ganglia, which would ultimately reduce the symptoms of Tourette's, namely tics, and additionally reduce the symptoms of ADHD. And that is the main part here. So discussion, this research was all based on pre-existing papers. So this was not conducted in the lab. So it's important to keep researching this project later on, especially with video gaming entering the clinical setting. It leads to a wide range of possibilities for new therapeutics and treatments that could be beneficial. And this is just the papers I'd like to give of credit to that helped me, figure out this paper and come to this conclusion later on. Of course, I would also like to thank Natalia, who was my mentor, who was a PhD candidate at the University of Chicago at the time of this, who helped work with me the past couple of years on this project. So I owe a big thanks to her.
Great, awesome job, Michael. We had 3 questions come in. The first one being, this is a very interesting topic. What drew you to research on this very topic?
Sure. So someone in my family actually suffers from Tourette syndrome. So I was drawn to this specific topic basically because of that. I wanted to figure out, that like hero sense of them. He wants to figure out something that could help them out in a way. But I also had started a charity donating video games to under-resourced youth at the time. So I thought, a great intersection between the two would possibly looking at video games and helping with Tourette's in that case and seeing if there was anything there. And I mean, there could potentially, that's what the research shows. So basically that's what drew me into this topic, but also my pursuing medicine, career medicine. So my desire to try to find a way to help that family member really drew me to connect these two things together.
Gotcha. The second question that was sent to my direct message was, were you able to investigate if different types of video games have different effects on TS? And if so, What did you discover? And if not, do you think this would be worth researching further?
Yes. So I was not able to. I was only able to the broad range of video gaming as a whole. It's explained a little more in the paper, um, how we weren't able to like find different video gaming. But basically this theoretically encompasses, PlayStation, Xbox, DS, um, what phone iPhone games. But definitely it would be worth investigating later on. My next project, which I'm pursuing, the goal to do in college over the next 4 years is to actually research different types of video gaming and see if there's a different effect on the raclopride decrease in the brain overall, because yes, that is a great point. We need to know that, is it just certain video games that work? Is it all video games that work? That's definitely a very important thing that should be researched, and I'm looking forward to doing that.
Awesome. And the third question I have for you is, what this is all very new to me. What was the most unexpected thing you have learned in this project?
Yeah. Um, Honestly, the most unexpected thing was learning that there is a beneficial effect of video gaming
Mm,
that could reduce Tourette's, because when I went into this, I'm like, I didn't know if this would lead anywhere. I thought I'd be doing research for a couple weeks and I'm gonna find the dead ends that, everywhere I research, it's like video gaming, um, what's it called? Video gaming worsens the effects of Tourette's because it just makes the mind um focus on too many things at once. And I'm like, I think I'm gonna find a dead end here. But then I researched one of my papers. I would love to give credit to them. I'm blanking on who it was now, but where it talked about this raclopride increase, and I'm like, okay, I think I can work with this here. I think we found something here. So that was basically the finding that video gaming decreases raclopride was most surprising and most interesting, and really was the foundation here that allowed me to continue this research and find these new avenues and find this potential pathway between the frontal lobe and the basal ganglia with respect to D2. So that was very interesting and that was very exciting.
Great. Thanks, Michael. Very intriguing topic, great
Thank you.
delivery, and we would love to hear more about your further research.